Fatigue is a very common problem for people living with inflammatory bowel disease, and one that can have a significantly negative impact on quality of life. And so in today's video, I want to provide 5 tips on managing fatigue in the person with inflammatory bowel disease. Number 1 is to ensure that the inflammatory bowel disease itself is under good control. Now, I think as gastroenterologists, this is the one bit we've typically been good at, and indeed we're getting better at. We can check not just symptoms and bloods, but also now a calprotectin, and use that to determine whether or not the disease looks like it's under good control. Number 2 is to correct anemia and any key vitamin deficiencies. Anemia in itself is a common cause of fatigue and correctable, but even without anemia, deficiencies vitamin B12, folate, iron, and vitamin D can all contribute to low energy and are correctable for the most part by relatively simple means. Number 3 is sleep. And that's really important for obvious reasons. Poor sleep contributes to fatigue, but it's particularly important in inflammatory bowel disease patients where there may be additional reasons why sleep is poorly controlled. It might be due to urgency and diarrhea, abdominal pain, or stoma-related issues, and really we should look at addressing those to help improve sleep and therefore improve energy levels. However, there are many other reasons why sleep might be poor, and I'll do a whole nother video on sleep hygiene and methods, tips and tricks for good sleep to optimize energy levels. Number 4 is diet. Good diet can clearly contribute to increasing energy levels, and that's both in terms of adding in good, nutritious whole foods as tolerated, but also reducing refined sugar and other inputs that can adversely affect energy levels. Very commonly, we see people who are unwell with inflammatory bowel disease reaching for sugary drinks and energy to give them that boost, or caffeine, or other things that actually can be counterproductive in the long term. Again, a big topic, a whole nother video coming on diet with tips and tricks from that point of view. And lastly, stress management and exercise together, because exercise is one of the best ways for stress management. It's Saturday in Edinburgh, the afternoon. It's gloriously sunny here. So I'm walking outside, getting both some gentle exercise and some sunlight in nature. These can be very, very good, simple tools for helping to improve energy levels. But there are many other ways that we could look at decreasing stress by actively reducing stressors, like a challenging, stressful job situation, or by having other helpful strategies such as therapy, friends, community. But of course, for a lot of people, this will be much more significant and be contributing or associated with more significant psychosocial distress, anxiety and depression. And we'll need to talk about that all a bit more. Perhaps lastly, a plea to my colleagues, which is to ask about fatigue. We don't necessarily have the answers, and quite frequently it's not so obvious what the answers are at all, but patients tell us that actually they want to just be asked. They want to have it recognized, they want to have the opportunity to verbalize it, and that in itself can be an important part of the therapeutic interaction. Thanks for listening. Be sure to subscribe. Interested to hear in the comments how you address fatigue, both personally and as a physician or as a patient. Thanks for your time. Speak to you tomorrow.